Good morning, friends. I'm Dr. Nazar. Today we will go with the further questions. So here you can see the X-ray of the right shoulder. This 80 years old woman falls on her shoulder and is subsequently unable to abduct her arm. The X-ray of the shoulder is shown. Here you can see the X-ray. Which one of the following is the most likely diagnosis? So here asking about the diagnosis. You have to see this X-ray and you have to diagnose this. So this is the head of the humerus, and this is the head of the humerus, and here this line is the neck, and this is the shaft. Once you will check the neck of this humerus, here you can see the discontinuity of the bone. So this 80 years old female is unable to abduct her arm. So options are, he is asking about the diagnosis. Options are acromioclavicular joint subluxation, exacerbation of calcific rotator cuff tendinitis. Option C is adhesive capsulitis of the glenohumeral joint, and fractured surgical neck of the humerus, and last one is the anterior inferior dislocation of the humerus. So this we can see from the X-ray that surgical neck of humerus is fractured. So option D is correct. The next question is, a 20-year-old man is brought to the emergency department. Keep in mind, whenever there is an emergency department, we have to give the correct answer. So a 20-year-old man is brought to the emergency department following a head-on motor car accident in which he was the front seat passenger. His only injury involves his left leg, which is seen to be shortened, flexed at the hip, and internally rotated. Very important point, that the leg seemed to be shortened and flexed at the hip and internally rotated. Which one of the following is the most likely diagnosis? Here again asking about the diagnosis. So here you can see that left leg is shortened, flexed at the hip. Here you can see the flex at the hip and internally rotated. So the options are central dislocation of the hip, fractured neck of femur, fractured pelvis, fractured shaft of femur, posterior dislocation of the hip. So the options are central dislocation of the hip. Here, as you can see in the examination, the left leg which is seen to be shortened. So a left leg can be shortened in the central dislocation of the hip, but flexion at the hip and internally rotated would not be there in this option, in this central dislocation of the hip. So central dislocation of the hip is not the correct answer. Why it's not correct? Because here it is a flexion at the hip and the internal rotation and flexion of the hip will only be present in the posterior dislocation of the hip. So as here we can see the other options like fractured neck of the femur, fractured pelvis, fractured shaft of femur, and last option is the posterior dislocation of the hip. So correct answer is the posterior dislocation of the hip, because it is here it is flexion at the hip and internally rotation. Flexion at the hip and internal rotation of the leg. And next option, which is fractured neck of femur. In fractured neck of femur, there will be a external rotation, not the internal rotation. So keep in mind to differentiate between the fractured neck of femur and the posterior dislocation and central dislocation of the hip. You have to keep in mind that in central dislocation of the hip, the this shortened leg will be there, but flexion of the hip and internally rotation will only be present in the posterior dislocation of the hip. And in fractured neck of femur, the externally rotated hip will be there, not the internal rotation. Okay. So the next option is the fractured pelvis. So in fractured pelvis, distortion of the pelvis region will be there, not in the leg and thighs will not be involved. Only the distortion will be there in the pelvic region. So here we cannot see in this scenario. And fractured shaft of femur. In fractured shaft of femur, thigh region will be involved. So any swelling or deformity will be there in the thigh region. So here in this question, this is the posterior dislocation of the hip. Our next question is a 25-year-old man pictured injured his right shoulder in a tackle while playing rugby and subsequently developed a severe shoulder pain and difficulty in lifting his right arm above shoulder level. The appearance on the examination is shown here. Which one of the following is the most likely diagnosis? So again asking about the diagnosis, 25-year-old man, right shoulder, injured his right shoulder while playing rugby and subsequently developed a severe shoulder pain and difficulty in lifting his right arm above the shoulder level. The appearance on examination is shown. Which one of the following most likely diagnosis? So here you can see this bulging. So here there are two joints you have to keep in mind. One is the acromioclavicular joint and another is the glenohumeral joint. Gleno is the part of the scapula and humeral is the part of the humerus bone. So this is the glenohumeral joint. So these two joints you have to keep in mind, acromioclavicular and another is the glenohumeral joint. So now we'll go to the options. Here we have to give the diagnosis. The option A is dislocated glenohumeral joint. As we can see that here everything looks normal in this area. So is there anything with the glenohumeral joint? No, it's as bulging we can see in the area of the acromioclavicular joint. And another option is the rupture of the shoulder rotator cuff tendon. Option C, fracture of the surgical neck of the humerus. Option D is the rupture of the long head of the biceps tendon. Option E is the dislocation of the acromioclavicular joint. So correct answer is the dislocation of the acromioclavicular joint. While playing rugby, he injured and subsequently developed a severe shoulder pain, difficulty in lifting his right arm above the shoulder level, and he had a dislocation of the acromioclavicular joint. So correct answer is the dislocated acromioclavicular joint, which is E. Our next question is a young man present to the emergency department. Emergency department, keep in mind emergency department, after injuring his shoulder in a fall. His X-ray shown testing motor function by resisted isometric contraction of which one of the following muscles would be most likely to confirm the presence of an associated nerve injury. So as you can see, this humerus bone on the X-ray and this joint, this is the inferior dislocation of this joint, and this is inferior dislocation of the shoulder of glenohumeral joint, and the nerve which involved, that is axillary nerve. So axillary nerve supplies the which muscles, that is deltoid. So the correct answer is deltoid. Here in question is asking which one of the following muscles would be most likely to confirm the presence of associated nerve injury. So because of this inferior dislocation of the shoulder on the glenohumeral joint, this axillary nerve which is involved, that is supplying this deltoid muscle, so deltoid muscle will be involved.